Hi, I'm going to talk to you today about the US Biotek stool test, and I'm just going to go over how to retrieve your sample. And then if any questions come up, please feel free to reach out in the portal and I can help you whenever you need it. So this is the US Biotek stool test. So it's in this green and white box, and I'm going to show you everything that comes in it. So when you first open it up, there is going to be instructions, and you're going to want to have these out when you're getting ready to do your sample so that you can follow it step by step after watching this video. It's also going to have in there, it's almost like tissue paper, but it has these sticky sides. You're going to peel off the tape and you're going to stick it to your toilet. This section is going to go on the back. So it's gonna look like this, and you're gonna hover over this and have a bowel movement on top of it, and that's where you're going to get your sample from. The reason I say hover over is because it definitely has the ability to fall into the toilet if you're sitting on it, just because it is paper and it can rip. You're also going to see there's going to be 3 test tubes, and the instructions are in there, but first you're going to start with the green test tube. This has liquid in it, so you want to make sure that you don't spill any of the liquid, and it has a spoon on the end. And so what you're gonna do is you're gonna take the spoon, you're gonna take from different parts of the stool sample, and you're gonna fill it up all the way to the red line and then shake it up. You're also gonna wanna make sure that your name, date of birth, and the collection date and time is on every single one of these tubes. So after you do the green, you're gonna take the red, which also has a spoon, and you're gonna take stool and you're gonna fill it up all the way to the red line. Same thing, you're gonna have name, date of birth, and collection date. And then this last one, it's like a cotton swab. And so what you're gonna do is you're gonna take the swab and you're gonna swirl it around the stool, but you don't wanna have clumps of stool. You just want it to be covered with light brown. And then you see here, there's a red line, and that part is actually gonna break off and you're gonna put it into the test tube. Inside, there's also going to be a bag. So you're gonna send this to the UPS store. Any UPS drop-off is typically fine as well. It's gonna have this biohazard bag, so once you collect the stool, you're gonna place all 3 of them in this bag before you send it out. And then I wanna show you the lab requisition. You need to make sure, this is gonna be a longer piece of paper, but I folded it because the information you need to fill out is all at the top, but this needs to go back with your sample as well. So you're gonna fill out this information here that is highlighted, and it just talks about the specimen, so in the time that it was collected, whether you put it in the freezer or the refrigerator, if you weren't getting it out for a day or 2, and then also if it wasn't that, then there's an area for that too. And then you're gonna fill out the patient demographic information here. Everything else is gonna be pre-filled out by Dr. Zimmerman and myself. And then you're gonna make sure that you send this in as well so that the lab knows exactly what we're running. Again, please don't hesitate to reach out with any questions that you might have.